Next, we're going to learn about the blood supply of the head and neck. This is the picture we're aiming to draw. It is quite complicated, but we'll take it step by step. So start by drawing the shape of the head, and then step 1, draw the arch of the aorta with 3 main branches coming off. The brachiocephalic on the right side, and on the left the common carotid and the left subclavian. So that's the brachiocephalic. This is the left common carotid. And this is the left subclavian artery. This is aorta. So the left subclavian becomes the left axillary. This is brachiocephalic, and that splits here into the right common carotid and the right subclavian, and that becomes the right axillary. Next, we draw each side symmetrically, but I'll just probably describe one side. So divide the common carotid into the internal and external carotid. So the internal here, you can see, comes in, and that goes towards the circle of Willis. And it's the same, pretty much, they're symmetrical, most people. So here you have the internal, here you have the external carotid. They divide at about level C4 to C6. And the internal carotid usually lies posterior lateral to ECA, but I've drawn it this way just so that you can see where the circle of Willis lies, and that it's heading centrally. The facial artery and lingual artery usually arise from the external carotid in the upper neck region, but they're shown slightly higher in this image just for ease of drawing. So continue drawing the external carotid upwards, and this goes all the way up to the top of the head, and it terminates by dividing into the maxillary and the superficial temporal arteries. So this here is the superficial temporal artery. And the superficial temporal artery splits into the frontal branch and the parietal branch. So this is the frontal branch and this is the parietal branch. And then that'll be the same on the other side. So I'll just draw it down like that. And there's the parietal branch here. Next, we're going to draw a sideways V from the external carotid in the neck. So that's just here. And they represent the superior thyroid artery and the ascending pharyngeal artery. So this is the thyroid and this is the pharyngeal. And then we move further at the face and we draw lines to represent the order of the arteries that come off. So we start with the lingual, and then the occipital, and then the facial artery. And this is like a snake's tongue shape that we draw. And then posterior auricular, and then the maxillary artery. This snake's tongue represents the facial artery's division into inferior and superior labial arteries. So that's superior labial, and this is inferior labial. And then we draw a line from the upper part of the snake's tongue to which is the superior labial artery, joining the transverse facial artery. So this represents the angular artery, and that is the terminal part of the facial artery. So on the other side, we can do the same again. So lingular, occipital, facial, maxillary, angular, and transverse facial. And then from the vertebral arteries, so we draw them further back, that come from the subclavian arteries. We can draw them dotted, draw them represented to go up in the back, and these go right up, down, and join to the basilar artery. and that's both sides supply the basilar and join together. So you can draw that on this side as well. That's the vertebral arteries. And then the basilar and the internal carotids are joined by the circle of Willis, which is the previous image which we've drawn, but the next chapter of the book.